Good morning. Board of Health Program Policy and Appeals Committee come to an order for January 17, 2024. Everyone, welcome to year 2024. We appreciate your presence here. Thank you for traveling from Hillsdale and abroad, Indiana border, and Allegan and various other cities and towns and counties. We appreciate being here. Thank you very much. Next on the agenda is number one, call to order. Ms. Fisher, could you please?
Commissioner Matthew,
Here,
Commissioner Leininger,
here.
Commissioner Baker,
Thank you very much for that roll call. 1B, approval of the agenda.
Mr. I want to add in, I'm going to insert old business, just a quick discussion on bylaws.
Okay.
I
In what
mean,
number?
they're not, that would be, put it as 2A, insert before new business.
I thank you.
I know we had talked about those last month, but
I thank you. Any other changes or deletion? If not, I take a chair, take a
and I
motion.
would move to approve the agenda as amended then.
Thank you. I second. Those in favor, please say aye.
Aye.
Aye. The ayes have it. Anybody here in absence here? No. Next is a public comment. We have a lovely young lady. Is she here to present herself? Well, I'm not.
She's here for the MCDC agreement update that's later on.
I see.
right,
And,
She's not in a hurry to expedite.
probably not, no.
Okay, all right. I thank you. You have your orange juice or whatever you think it is efficient for you. Thank. Next is public comment. Anybody on the line besides our good friend on the line right now? Next is our friend Commissioner from Hillsdale mentioned about 2A. Go
Yeah,
ahead.
so the bylaws, and I know they were not in our packet, but we had discussed those last month, and just for review.
Yeah.
We had even talked about those at the Board of Health meeting. So just a refresher that there is going to be those bylaw changes at our Board of Health meeting later on this month. And there was just the two things that we're gonna change in there.
yeah,
And I'm trying to find that here on in last month's Board of Health packet.
Correct. I left it.
Or we were going to remove as far as the payment from the tri-counties. And then, changing as far as the specification of calling the chairman of the board to call special meetings even for committees, so.
Okay.
Okay,
All
and
right.
I don't know if anybody, Tom, if you had thought of any other changes on that. Forget, we have to have what, 10 days notice,
yes,
so we can't, but yeah. I just wanted to make sure that we specified that those changes were coming to the meeting.
Do we have to recommend to the whole committee or?
I think we had, in essence, from last month
Yeah.
in December, that recommendation would still carry forward, so.
So need to take a motion from the floor?
No, I don't
Just
think
a
so.
discussion, all
Yeah.
right. So if any comments further, we can discuss at the whole committee, correct?
Correct.
Okay, thank you. I appreciate bringing that in, and any further? No. If not, I may continue. Number 3 is new business, Board of Health intergovernmental agreement, which we have received from the health office. Had the opportunity to look at. Please.
And Commissioner, I guess, one that kind of reports that we need to maybe consider changes to this. Specifically regarding the funding,
Yes,
underneath, and again, I don't think we have to have these changes made right now, but just something that we as a body need to be looking forward to, especially, when you come to the, term of service for board members and, I had that, forget what page that's on.
is that 2 years to 4 years?
Well, the question would be the language that we have here.
On page 3 of 10, under term of board membership.
Okay, yeah, thank you, Teresa. The language there in that,
Yeah.
is, if you see on the
Paragraph.
fourth line, the first paragraph, fourth line down,
Mhm.
where it starts at the beginning of the page, January 1 through December 31st,
Yes,
commensurate with the Board of Commissioners term. Well, we have a 2-year term. And the line before that, starting January 1st of next year, Board of Commissioners are going to 4-year terms. So we either need to strike that out, that commensurate out, and ask for the tri-counties, the 3 counties to approve that language change. Because this has to be approved by Branch County, by St. Joe County, and by Hillsdale County. And again, any changes to this that we recommend, we need to make sure that we stress to our boards that we don't change anything else in that, because if any one board changes something, then that's gotta be approved by all 3 counties. But again, something that,
Thank you for pointing out, you're right. I mean, of course, we will be forwarding to the entire board. But the good thing is, next year, we will have all new board members. I mean, we are all in election, so we don't know who is going to be here.
Right.
but I think we want this done this year.
Absolutely.
Before,
Yes,
the terms of office for next year, so that that we can get it approved by the 3 counties, and then B, that we can submit it to the governor and the Michigan Director of Health and Human Services for their approval as well.
correct.
The other thing is, because we removed from the county bylaws the language regarding, or from our bylaws, the language regarding county appropriations. There is a section here, section 5 deals with finances. And there's some language there, and I haven't worked on the exact.
Page
potential-
6, right? Are we
Yeah,
talking about page 6?
of
Okay.
10. Some potential language revisions there. But as far as dealing with those, the county potentially inserting some of that appropriation language that we struck from the Board of Health bylaws, and consider inserting that into this joint operating agreement regarding the payment schedule to the agency. Because that is not in the joint operating agreement. So this is something that's probably gonna be on this committee's agenda
Next time.
for a few times, just making sure that we get that language right, so.
Very good.
The other thing is, where this year where and maybe something that needs clarification in this language as well, is for this year, the health department had requested and had sent the request to the 3 counties for the 15-cent per capita increase. We had 2 counties reject that. I think there needs to be some clarification, maybe inserted into that joint operating agreement, where if a county rejects that, where that change is not applicable across the board. Because I think if you read this, I think if 1 county pays it, 2 counties don't, the Board of Health can actually diminish service in that 1 county. Or in those counties that don't pay that. And so I think there needs to be some clarification on that funding arrangement.
Okay, we'll look into that.
The
further.
reason that was inserted was because we had one county, two counties voted for it and one did not, several years ago. And so, that was the options that were discussed at the time as a way to recapture the funds that were not appropriated.
Yeah.
So just so you know, the history of it, that's how we got
And
that.
I think some of that may also be spelled out in state statute. If memories, I don't,
I'm not sure about that, but
yeah,
yeah. Also, for your information, I did reach out to MDHHS staff that we work with regarding modification of this to say, just making sure the process remains county commissions, then director, then governor. And she was doing some checking. She thought that maybe it wasn't necessary that the governor signed a letter. So she's still getting back with me, but I
Okay.
want you to know I did reach out.
all right. So, yeah, so something that, I guess, Teresa, I know you had it in last month's Board of Health packet. I guess I would just suggest that this committee continue to stress to the full board that this is something that we're working on revisions to. As we get some of that language revised, we'll be presenting it to the Board of Health, for potential requests for the counties to adopt, so.
Very good. Thank you so much, and we'll study into it further, and I'm sure the health officer, Ms. Burns, and the clerk also will be looking into more details. So thank you so much. May I continue? The next item, number 3B, employee recognition. That is so wonderful. When I was informed 25 years and 5 years, I was just born 25 years ago.
Time flies. Yeah.
I'm glad Miss Sutter is not listening.
So when did Laura hit her 25 years?
Sometime during 2023. Do you know what her anniversary date is?
I wanna think it's in like June or July.
Oh,
So-
she's got me by a month or two then.
She doesn't know I have a Sutter family.
I
Yeah.
have 25 years as a Farm Bureau agent
Oh,
on
good.
August 8th of last year. so-
All right,
Congratulations.
congratulations.
We should recognize you at the
No,
next
no,
meeting,
no, no.
yes. Yeah, we
No.
shave your one side of your.
I'll have my 25 years in August of this year.
All right.
So,
So back to the employee recognition, Ms. Burns.
Yeah, so every year we recognize those milestone years, and we wanted to bring this information to you so that we can formally recognize them at the full Board of Health meeting.
Unfortunately, I'm not seeing any 10 or 15 or 20-year recognitions here, and that's, part of the problem that we've had with turnover is.
Right. Well,
we actually have quite a large group. Oh, I guess that's a relative term. We have a number of staff that we recognized last year for 15 years. But below that, it gets a little sketchy as far as, because we lost a lot of staff in the pandemic. And it was those folks.
How many total staff?
Here we have 76.
yeah,
Okay,
How many, please?
76.
76.
Yeah, of course, I just came from annual sales kickoff and, with 140 agents, you've got a lot bigger pool to come from to have a
right.
5, 10, 15, 20, yeah.
We did lose significant group, and it quite frankly, as we've mentioned, we do have to continue to try to compete with other local health departments, and we don't fare so well sometimes, so.
I don't want to change the subject, but Miss Sutter, she has been here 25 years.
Yes.
Amy Elkins Little, 5 years.
Mhm.
Lori Hibbs, 5 years.
Mhm.
Barbara Keith, 5 years.
Yeah,
Laura Sutter, 25 years. Well, somebody told me you have been here for 36 years.
Me?
How much? Yeah,
I'll be here 30 years in
30
October.
years. I'm sorry, I mentioned 36.
I'm just a baby. I can't possibly have 36. Yeah, no, yeah.
Well, we appreciate Commissioner Leininger and I and others, all 6 of us really appreciate all 4 of these wonderful staff staying with us. I pray that I will be here for her 50th anniversary year.
Yeah,
Well, I'm halfway there.
yeah,
Oh, yeah.
My intent, yes, it's 50 years, so
that's crazy. Wow,
Congratulations. May I take a,
I'll only be 74.
just a baby.
so I am the youngest among you guys.
Yeah.
Wow. I take a motion, chair entertain a motion.
I don't know if we need a motion.
No. I believe to bring
I
it to,
don't, I
no,
don't think so.
all right
We'll
then.
just bring it up and,
Okay, all right.
And,
As-
and the chairman of the board at that point in time will get to recognize those individuals.
Oh, we have a new chair.
Yeah, hopefully I guessed the right one and the certificates will have the right name on them.
maybe you should print both sets. There's only 4.
Well, actually, he is still, technically, he is still the chair. He can sign. A bit. Doesn't matter. All right, we'll, thank you. We'll bring this forward to the next meeting tomorrow, correct?
No,
Mm,
next week,
Next
Next
Thursday.
week.
Next Thursday. Oh, my schedule. All right, next is 3C, MCDC agreement update. Okay, I have a few questions there too. Go ahead, please.
Sure, so that's why Kim's joining us today and thank her for being here. Kim represents MCDC as the governmental, what's your title, Kim?
Governmental affairs, community and governmental affairs.
So-
Pardon me, Kim's full name, please?
Kimberly Singh, Singh.
I believe I met you
At the Hillsdale Open House, yes.
the great
Yeah.
county of Hillsdale.
And Kim, let me start off by saying I apologize for the issues on Monday.
Thank you, and I think we've got everything worked out, so things happen, and just appreciate your support.
Ms. Singh, if I may, I want to say it was one of the best open house with that sandwiches and drinks and serving and our health officer, Miss Burns, directing people and your staff were wonderful.
And the cookies to make sure you get more cavities.
Yeah, exactly.
Thank you.
It was good.
Go ahead.
Well, so the agreement that we currently have with MCDC for our centers in Sturgis and Coldwater was created during a time when we weren't certain about the future of intergovernmental transfers. And so what that allows for is an increased reimbursement rate for Medicaid patients and really allows MCDC to do their work in a way that provides Medicaid patients the best service in a quality dental center. So we haven't needed to do any intergovernmental transfers, and so there's a request here to update our agreements to remove the outreach and education payments that MCDC was giving us per chair. And Kim, do you want to just kind of tag on there and add on anything that I didn't properly talk about?
Sure, and again, we've got 4 dental centers. The first 2 being Hillsdale and Three Rivers were opened in 2008 and 2011 respectively. And as Becky has indicated, those agreements provided where the health department or the counties would contribute a quarterly intergovernmental transfer. We would then get an enhanced rate through federal match for serving Medicaid adults. As part of that, we also continued to pay the health department what we call the community education and outreach payment back. That was arm's length, but it in essence made the counties whole for that initial payment to draw the federal match. In 2017, we were able to add 2 additional centers. And as Becky indicated, at the time, I think those agreements were similar to the other 2, but we were able to secure state funding for the required match in 2017. So what we've done for actually 17 of those health departments were added. We really had rapid growth and doubled in size, but 17 of our dental centers were supported by state funding for those transfers. And we set up a separate payment mechanism for those community education and outreach payments that equaled $2,000 per chair. Those payments, I think, were meant to support local public health, to support outreach efforts. They were never tied to any costs in the health department. We, in fact, actually supplied any of the materials for outreach, being print materials and promotional. And so we've asked, as we move forward into 2024, that we remove those community education and outreach payments, that we continue, I think the word would be challenge. We would like to redirect those payments into the operations of each of those dental centers. We continue to incur, increased, as everyone in healthcare, but again, a cost of supplies, cost of equipment, huge costs in labor. So again, in the spirit of ensuring we can continue to provide quality dental care, continue with access to care, we've asked that we remove that. And again, that only applied to your Sturgis and Coldwater Center. So that's the first piece of the request. And we value our health department partnerships and are very honored that actually there are several health departments, we've listed those in your board packet, have all agreed. They all value and understand that. So that's part 1. The second part is actually, I think, an action item that asks that we amend the agreements, not to remove the education and outreach, but to make it more clear. Because again, it is an arm's length, but to require that should we need intergovernmental transfers like that in the future, that we would have an annual meeting that outlines what that would look like. So I don't know if I added confusion or clarity, but there's 2 steps. One, that we discontinue as of January those $2,000 per chair payments. And secondly, there's an amendment that would help clarify, should we need a transfer and should we be then paying you a community education outreach payment, it would tie to an annual conversation. Because as it reads now, and part of it was for a reason a little bit unclear, is the health department could out of the blue just send us an invoice for education and outreach, and as it reads, we would have to pay that payment, where this would tie to, an annual understanding of the basis for that.
So, Ms. Fisher, our budget is already completed, correct?
Yes.
And can you give us an impartial information, what will happen if we do not receive that $4,000 from the MCDC?
I don't think there's going to be a big impact on our budget at the current time. During the pandemic, we didn't do a lot of the outreach that we typically would do. And so some of those payments are actually sitting in deferred revenue right now. So we wouldn't see an impact for a while, because we still have some of that funding sitting there that we didn't spend on outreach during the pandemic.
Commissioner?
what is the fiscal impact on this? Because it's $2,000 per chair. How many
Per
chairs?
chair, there's 12 chairs involved.
So it's $48,000.
No, 2 times 12 is 24,000, is that right?
Yes.
You're right, yeah.
So, and we bring this to you because we need you to agree, but in my opinion, it's far more important that we continue to offer these Medicaid dental services in our counties than it is to continue to insist that we receive these education and outreach dollars. We need these dental services here.
But we're still gonna continue to receive those for the Hillsdale and the
Three Rivers.
Three Rivers Center, right?
It's still in those agreements.
So that was a different arrangement and it is confusing. So for the Hillsdale and Three Rivers, there was an intergovernmental transfer by you. So let's say, you know, you had to transfer on a quarterly basis. The state figured out the difference between what Medicaid rates were and an enhanced rate. So the state would say, okay, you need to transfer $50,000 a quarter. It varied based on the care provided. It was tied to care provided that quarter to Medicaid adults. So the state would give notice that you need to transfer 50,000 in a quarter. Again, you would pay that, we would draw an enhanced federal rate. Well, the provision, and purposely not arm's length, provided that we would then pay you a community education and outreach payment that would equal the 50,000 plus 5% back to the health department. The goal is to make sure you are made whole. Right now, with the Medicaid rates that were just increased in January 2023, we haven't needed that provision. There may be one final payment, but we haven't needed that. But yes, the provisions in Hillsdale and Three Rivers would remain. Should you make an outreach payment, we would then, or should you make an intergovernmental transfer, we would continue to ensure you received a community education and outreach payment.
So we get them when we do one.
Okay.
So Kim, we used to do those one a quarter. Why are there not so many now?
The reason is, again, twofold. Even before the Medicaid rates were increased in January, the state funding was increased to the level where it helped support some of those local health department transfers. So even back in 2022, the tail end, the state funds were able to, and for us, that was very significant because when the state contributed the match, we kept 100% of the enhanced rate. The net effect over the course of the history is when we were paying the health department back that outreach payment, we were in essence losing 40% of an enhanced rate, which we were saying was no longer even sustainable. We were really jeopardizing the whole model. So to answer it, back in 2022 or early 23, the state was contributing. And now, as of January of 23, the state has raised Medicaid rates to equal what an average commercial rate for dental care would be. So similar to, you know, what a private practice dentist would get from Delta Dental. So negating the need for any enhanced rate.
You have any further comment? I do have one. I would like to have a little staff information on this subject a little more, but we can forward to the whole committee. But I want to make sure that budget is covered and various other things. But we appreciate Kim, your suggestions and your ideas, well taken.
How much do we currently have in fund balance for community outreach for?
I would have to look that up. I don't know the number right off the top of my head. Let me see if I can get that for you really quickly.
And I guess the question would be is if we stop, if we accept the modified agreement, how does that affect us? I mean, in the future, in that community outreach aspect, because we don't have those funds, you know, we don't have that $24,000 annually and potentially the other from Hillsdale and
Well, we haven't been getting the stuff for Three Rivers and Hillsdale for a while because they haven't needed us to do the IGT.
Mhm.
It's probably been, I don't know when that stopped, but so, we just need to look at other opportunities to fund, the work that, we do for that education and outreach for our health educators and for any nursing staff. So, you know, again, these centers, they need to redirect these funds to be able to keep these centers whole. And I would much prefer that we have Medicaid dental services than to not. And, we don't want to risk losing one of these centers, financially because they just can't make the model work any longer.
Yeah, and so, part of the problem that we've had here is that our staff have, especially our clinical staff, which do a lot of this outreach and education piece. They're funded by multiple different funding sources. So for example, a nurse that works in our clinic, if she's working WIC one day, she puts her time in WIC. If she's working immunization, she puts her time there. She could be working communicable disease or STD, HIV. She could also be doing dental outreach. And when she's in the room with a patient, we say that, if you're doing dental outreach, we want you to put your time, record your time that you did dental outreach. Okay, and then we'll pay you out of this bucket. The problem is that when they're in with the client, they're in with a WIC visit. It's a 15-minute WIC visit. Yes, they did dental outreach and education, but we keep tracking 15-minute blocks, so they didn't do enough of it. So it's easier for them to just put their time in WIC, which it still qualifies under WIC. So we're not spending these dollars down as we expected to, because it's hard for the nurses to keep track of exactly how much time they spend in each program allocation.
We have enough funds for the educator. What's his name? Josh? I forget.
Yeah, we have Josh and Bella
Mhm.
and Chris now is also there.
Yeah.
We don't need these funds right now. We don't need them.
Well, and it goes back to the same problem we have with most of the money that we get, right? If we're doing dental outreach and education, and that's all we're doing, then we would charge that grant. But when we go out and do an outreach event, we're not just doing dental outreach, we're doing Medicaid outreach, we're doing WIC outreach, we're doing immunization outreach. And so it's just been very hard to get our staff conditioned that they have to put time here. It's not that they're not necessarily doing the outreach, but it's just they're not doing specifically dental outreach. They do outreach of all programs at the same time.
I agree with you. Just for the Kim, I live in a community, mostly we have our neighbors far away, but we visit certain communities. We can really use a dental clinic or something there. I have been advocating since past 5 years. I mean, indirectly, of course, in Kinderhook, California. Just came to my mind. I didn't want to interrupt you, but thank you. You have any further comments?
I guess I would recommend that we submit the revised contract agreement with MCDC to the full board for approval.
For the finance and the wording.
Yeah.
Sorry. Thank you. I second that motion. Those in favor, please say aye.
Aye.
Those opposed say no. The ayes have it. Thank you very much. And Kim, congratulations so far.
Thank you for your support.
Will you be joining the meeting next Thursday too, Kim?
That will be good if she
I think it
can.
would be a good idea, yes.
Yeah.
We do too.
That'll start at 9 AM and I'm guessing that we won't get to that probably till 10.
Or we can make adjustment if you have Department of Health or something in the Lansing meeting. Let our officials know here, then they will arrange, we can make the agenda
Sure, yeah.
adjustment.
And I can put the agenda in any order that you'd like. If we
Yeah.
want to put that first before departmental reports, we can.
All right.
Okay.
All
We
right.
will get you the information, Kim. And if it is necessary for
Yeah,
you to
it
remote
looks like
in.
I do have a call, but I would change it from 9 to 9:30. I would be at the Board of Health if I needed to, but I'm free after 9:30 and I can juggle things around. So
Okay.
I can make 9 or 10 or whatever you need. I will be on the call.
Will you need us
Well-
to bring you in remotely to that one?
That would probably be better, but I can let you know, Becky.
Okay, thanks.
All right, and is a need for a closed session.
Yes, I move that we go to closed session to consider material exempt from discussion or disclosure by the state or federal statute, per section 8H of the Open Meetings Act. To consider, attorney-client privileged information.
I second that. Roll call, please.
Commissioner Matthew,
Yes,
Commissioner Leininger.
Yes.
yes. We are in closed session.
Well,
Let me pause the
Thank you. I will leave. Appreciate it. We'll see you next week.
Thanks, Kim.
Don't stop. All right, so now I move to exit closed session.
Thank you. We are back into session, public comment.
Well, wait a minute.
Oh, I'm sorry.
I move to recommend the attorney's guidance to the full board for approval.
I second. Those in favor, please say aye.
Aye.
Aye. Those opposed say no. The ayes have it. The motion carries. Next in the agenda is public comment. Anybody there, please?
There's no public, but I did want to ask you about the kindergarten oral health dollars. I've been informed that if we accept a planning grant this year, we will not be held to continuing on after year one. And so if we want to accept the funds that are available as a planning grant for the rest of fiscal year 24, I need to make a decision prior to the 22nd of January. So
How much money is that?
it's like 62,000.
We have,
We probably wouldn't even spend it all. You know, my plan would be to assign a health educator to a project and working on interacting with the entities that might do this work. Kim Singh being one of them. However, she and I have talked, and it's not a good move for MCDC at this time. They don't have, you know, they wouldn't have staff. The cost to do the program, many reasons why they would opt not to be the provider for us. So if we accepted the funds in the future, after this fiscal year, we would be looking probably, that's why there's a planning grant. We would be looking at a model where we utilize an existing provider and contract with them to do the service. So Kim Crabtree from Smiles on Wheels has reached out to me previously. She's interested in taking it on.
this is for all three counties for,
Yeah, I
All
think for
three.
all three, yeah.
are they mobile? I mean, the one Crabtree mentioned, I know a few others.
Oh, it's, that's a really good question. I'm not sure where they're holding that. So,
I'll go that way again and ask if they know. Thank you.
okay,
This time he did, so.
yeah, yeah,
So,
okay.
I'm sorry, three counties
Mhm.
for being a former Head Start director. I am for, you know, children's early health, dental health and other. But I'm sure in cold water.
I mean, yeah, 65,000, that's not gonna get it done in one county, let alone three counties.
Right. So, you know, there's some conversation out there about there being additional appropriations to this. But will that happen? Who knows? Maybe they'll stop all appropriations in the future. But, you know, is it the right thing to do? Sure. I mean, kids should have that oral evaluation, but, you know. So,
They want it before entering kindergarten though, right? Or in first or second grade.
the idea is before kindergarten, but some kids don't go to kindergarten, so they can get it before first grade. Yeah,
So I said, cause I know, like you said, Smiles on Wheels has reached out and I know that they're in, how many districts are they already in the county? Do you know?
I don't know, how far but they're out there. I know they go into St. Joe and I know they go into Hillsdale and I'm sure they're in Branch, so, they're out there.
Also,
Mhm.
you have a Hillsdale dentist, you have a Coldwater dentist, you have, not Coldwater, rather Branch County. Then we have St. Joseph County. We have a dentist who want to provide, I know the money will be less, nobody want to take perhaps, but because they love the children, want to give a service to them. So there is a chance if 62,000 we get this year, next year, you may have somebody up there to get more funding.
So the assessment is done by a dental hygienist mostly. It could be done by a dentist, but it's not a requirement that an actual dentist do the assessment. A hygienist,
It's no different than in a dentist's office today.
right,
You don't ever see the dentist or.
right. You see the dental hygienist, yeah, yeah. Well, you couldn't hire a dental hygienist for 62,000 for a year. You couldn't do that. They command a much higher salary than that. So the only way this would work would be contractually with other entities. Unless we're gonna throw in a bunch of local funds, which that's not the plan at all, no plan of that. So, you know, I guess I'm just bringing this up because, I don't see any harm in accepting the planning grant.
If we
And
don't
putting
spend it,
some-
we send it back. to
And
the
if we
state.
don't spend it, we send it back, and we're not tied, they cannot require that we do the program in 25.
And we can accept that planning grant and then see if, just that we've got money to pay to do a cost study with Miles on Wheels or whoever to see if we could partner with them to
Yeah,
do that.
so I
And
don't
we've
see
got
any
the money
harm.
to pay our staff.
We've got money to help with the health educators for, a one-time project, yeah.
We can at least get a 500 children, still it is worth it.
And
Healthy,
again, I don't know,
healthy teeth, healthy heart,
I don't know where Smiles on Wheels gets their other funding. I don't know if the school districts pay them for that service.
I actually don't know either. I don't know. I assume that they are billing.
Because, I mean, it's. We're already doing this. Why do we need to
Mhm.
mandate somewhere else that it's being done?
Well, the money is coming, resources are there. We are first step, next year it will be more.
I don't think it even needs board action. I'm bringing it up because,
Well, yeah.
like with the new job thing, we got that money, right? And, adding additional staff, the contract kind of says that you need to sign off, so.
I am for it, anytime it comes to children, I mean, you are too, I know that, but fiscally. If we start something like Ms. Burns is saying, next year it will double, I know that. Same, that is.
Yeah,
Anyway,
your
but
tax bill will double next year too, Tom.
well, our future children, look at me. You guys your parents taking care of me, so I have a good teeth now. So anyway,
So do you want it to go to the full board or
I would talk about it at least,
just put it in my report?
yeah.
Thank you, will do.
meantime, I would check a local, we all have dentist in Hillsdale,
Mhm.
Coldwater, I'm sure you may know somebody our commissioners may know in St. Joe County. Give them the opportunity to serve their community, divided into 3 or 2, so 3 dentists doing, like you said.
Yeah, but Tom, they're not set up for mobile work, which is where, to reach these kids, a lot of, the school district where I'm at, the closest dentist is 12 miles away.
They have a bus, so the whole class goes in.
The, Smiles on Wheels has a mobile unit they bring right to the school.
Guys, whatever way it is best, I think we should consider at least, I'm sure you like. Any other public comments, please?
Move to adjourn.
No, we have one more.
It's adjourned.
Yeah, any other subject we need to talk about,
No.
for the good of the whole?
Move to
The
adjourn.
Spartans, Waldron, the Spartans. Okay, we got a motion for adjournment. I second, those in favor, please say.
Aye.
Those opposed say no, the ayes have it. The meeting is adjourned. We thank you for everybody, including Miss Kim, for joining us today. We appreciate Ms. Fisher and our health officer, Ms. Burns, and Commissioner, extraordinary commissioner from Hillsdale. Thank you so much. Have a blessed new year. Thank you.